Excellent. Really excited to be here with the Master Circle group today. Some of my favorite doctors. And let me see if I can tell this to run and also be able to watch for people that need to still enter in. I didn't realize how hard it would be to try and do both, but we're going to make it through. So if I share my screen. You should be now on my presentation that we'll go through, and hopefully this will be of great help. What I can't see, let me see. I'll make a bigger one there. That might help. What I can't see is all of you, if you're having difficulties hearing or seeing anything, you've got to let me know, okay? I can see Kim and I can see Brian, so you just raise a hand or a thumb or something if you've got some things that I need to be aware of. I can make it bigger. That'll work. Francis, great to see you as well. Okay, this is our Rezzimax Masterclass. We're going to talk about maximizing outcomes and effectiveness through the vagus nerve entrainment. And these are the topics we just talked about that we intend to go over. All of you should have access to this presentation. If we need to make a cleaner copy after the event and send that to you, it has links to any of the video clips that are on here. So it should be a great help. Let's just go ahead and get started. Since we first met the Master Circle group, we now have two placebo-controlled double-blind research studies under our belt. The first is expected to be published very soon. It's gone through 2 revisions, and so it's in the peer review publication process. That's going to be a fun one to see. It's the resonant effects of headache management. The second study that we finished in 2023, it was on resonant effects in dysmenorrhea. And currently that's undergoing statistical analysis, slowed down by global upheaval. The third study that we're intending to undergo in 2024 is on the effects of chronic TMJ, TMD management. And we're working with a major university, a U.S. university dental program, to conduct that research. The importance of the discussion on research is this: we must be able to prove the effectiveness of our treatments, right? And if we don't have the research to help back that up, well, we need to get it. We need to prove it in the clinic, but we also, and we've seen our effects in the clinic. It's really neat, especially in some of the first research that we've seen the results on already. We're seeing effectiveness of a much higher level than medications. Isn't that fun? That's all vagus nerve entrainment. So if we step into just a couple of videos really quick, can you all see that screen okay?
Yes.
Great. Let's see if you can hear it okay.
Today we're going to...
Whoops. I need to turn that up.
Today we're going to use the Rezzimax Mini tuner to promote healing in your head and neck. For this recipe, all you'll need is your Rezzimax Tuner Mini. You can use the extremity strap to hold the tuner in place if you like. Remember to place your tongue between your teeth and hum gently along with the resonance of the tuner. This helps your vagus nerve to magnify the positive effects. Step 1. Choose a comfortable level of intensity. Using a light amount of pressure, place the tips of the tuner mini scraping edge on both sides of the neck, with the mini resting against the spine. Slowly rotate your head from side to side, keeping pressure against the device. Keep doing this for 5 minutes. For added comfort and convenience, you can use your Rezzimax pillow to support your head. The extremity strap is another great option to keep the mini in place. Step 2. In this step, you can choose whatever level of intensity feels best, or you can switch to one of the pattern modes. Use a light amount of pressure to place the scraping edge under your jaw. You can choose the concave or convex edge, depending on which is most comfortable. Hold the tuner mini with both hands. Keep the tuner in place for 1 to 2 minutes.
So I could take the time to go through all of that. But here's what's really, really important with that. Back now, it's been 3 years ago, 4 years ago. Bob came to me, it's been, gosh, over 4 years ago. Bob came to me and he said, look, I've heard about your incredible product. We need to share it with the Master Circle. And as soon as I started sharing it with the professionals in the Master Circle, Bob came to me again. He's kind of subtle that way. But he came to me again and he said, you've got to figure out how to help people understand how to use your machine. He says, everybody thinks it's really cool. And so a bunch of our doctors have bought it and then they sit it on the shelf for a long time and they don't know what to do with it. Well, here's what's most important. If there's one thing that you learned from what we're going through today, it's that you understand how to be able to utilize our resources that we've created in the last 4 years, in large part because Bob told me that you guys would be able to understand these tools and techniques a whole lot better if I did a good job of sharing how to do it. So you will notice that if you go to our website now, and let me see if I can pull that up really quick. Let me see if I can, where are we at on our website? Pull up Rezzimax. There's a couple of things that will really help you guys out. We have made a section in here that just makes it really easy. First of all, if you go to our learning section, or just scroll over that learning, you'll notice that it covers recipes, mini recipes, Tuner Pro basics, Tuner Mini basics, how to use our app that we created for the Mini, some things that Nerd Solutions courses. These are courses and things that we have done. I'm not sure what Classroom is. I'll find out. There's information on our certification course, and that's a great process. Anyway, there are great resources on our website. The Rezzi section is how you can go to all kinds of techniques if you want to learn about how to use it best for horses. There's all kinds of techniques that that'll take you through what to do for our four-legged friends. I'm not going to take the time to go through all of these today. Just realize that if, for example, we call these recipes, and you want to look up absolutely anything on how our techniques work well for head and neck, you just go into those recipes, click on head and neck, and you'll be watching videos like the one we were just showing you on how to use the Mini for head and neck. This particular one shows how to use the Tuner Pro 2 for all of these conditions. So there's great resources in our materials that we've been creating to help you out. I just wanted to make sure that you guys understand that. We created all of those videos in part because I wanted you to have 2 or 3 minutes to review some of our best techniques. If you've got a client coming in with a particular condition and you want to make sure that you know what to do on our using our tools.
Today we're going to use the Rezzimax Mini Tuner to promote healing in your head and neck.
I'm going to go to a couple of other things really quick. So if, for example, you have a question about how to use the Tuner Pro 2, if you click on that link right there, it'll go to the tutorial videos that just give you the body parts and the techniques for the Tuner Pro 2. This is also the channel for the mini recipe techniques. We have 11 brief videos there. Oh, sorry, I messed that up. The Rezzimax tutorials has 14 different short videos that help you understand how to utilize every aspect of those tools. And then there's a section on our website that talks about how to join our Rezzimax affiliate program. So one of the most important things that I could do for you today is help you understand where to find the resources for everything that we're covering. Now, let's see which one this one is.
Let's dive first into
This particular video is an advanced technique, meaning this is one that's not even public. So watch this if you'd like to, but I think we have a link to it. But some of these techniques that that are not shared with the public are incredible for you as a practitioner. These would be the starting place for all kinds of conditions. Almost every condition, you need to wake up the connections from the feet on up. So let's watch this one.
Advanced recipe for foot and ankle. You can use your Tuner Pro 2 or your Tuner Mini for this recipe. Remember to place your tongue between your teeth and hum gently along with the resonance of the tuner. This helps your vagus nerve to magnify the positive effects. Step 1. Set the tuner to the highest level that still feels comfortable. Some patients might find it difficult to reach this position on their own and will need someone to do the channeling for them. With a deep amount of pressure, use the tip of the tuner wing to make a channeling motion on the medial side of the ankle and calf in the space behind the Achilles tendon and the fibula, from the ankle to the knee. You should be able to complete this step in just a couple of minutes.
I want to stop it for just a second. Many of you who have used our tools have probably not seen or felt this particular technique. If you want to wake up the phone lines from the tips of the toes all the way up, this is an extremely important little technique. Try it on yourself, try it on the people in the office, your family members before you do it with a patient. But this is absolutely incredible. About the only time that we would avoid using this technique is on somebody that has active CRPS, somebody that has an active wound, of course, or somebody that that is not clotting blood, because as you can imagine, a little bit of point work in there, you could have some significant bruising. But this is a tremendous technique for everybody that has neuropathy or all kinds of, let me see where we're.
Let's dive feet first into this advanced. Repeat along the lateral side of the ankle and calf. Switch to your other leg and repeat the step. Step 2. Set the tuner to the highest level that still feels comfortable. Now use a deep amount of pressure to make a channeling motion with the tip of the tuner wing along the bottom of your foot, from the toes to your heel. Start at the space between your first and second toes, then move to the next web with each motion. When you finish channeling between your toes, rotate the tuner wing so that you're using the corner of the foot.
It's important to let you know that in this one, it's fairly firm pressure too. And I've had people scream and then get up and say, I have never felt my feet feel so good. So it's a firm amount of pressure, but make sure you tell your patients you are immediately going to sense and feel the ground like you have not been able to in a long, long time. And they're usually okay with that. As soon as they realize that that all that you did was for their good, they're happy.
Scraping edge to scoop along the same lines. You should be able to complete this step in just a couple of minutes. Switch to your other foot and do this step again. Thank you for joining us today. So
those couple of things with the feet make all the difference for all kinds of foot conditions. I want to tell you about one particular patient. that came in. He had just had nerve conduction studies. All three of his major nerves in the lower extremities were in the red zone, and he was recommended for surgery. He started doing this daily, spent about 20 minutes going over his legs and feet and all the way up to the hips. 1 year later, had a repeat of all of his nerve conduction studies. They're now all in the green zone. His doctor tells him he's had a 90% improvement in all of his nerve function in both sides. And he said, you know, the thing that's important to me is I can walk and I don't have any significant pain. I can move around. I can sense and feel the earth beneath me. It can make a world of difference. So here's what's important. With all of these conditions, the neuropathy, the stroke, multiple sclerosis, paralysis, Parkinson's disease, all autoimmune conditions, that set of techniques is going to be important for absolutely every one of them. And even if the individual tells you that most of their concern is in their neck and shoulder, I'm going to promise you that if you will add in some of these feet and leg techniques, their nervous system will start the healing process a whole lot better. That's been one of the funnest things to see. And I can show you cases of each of these conditions where just working on their feet started and significant improvement in the healing process. Next, I wanted to make sure that you guys understand, for our mini device, the new one, there is an app, and it's now available for, as of 2 weeks ago, it's now available for Android, and it's been available for about 9 months, but it's still been improving for the iOS. So anyway, we have those new apps for the mini. You should get on. There's a section, remember back at our website, there's a section for how to learn about the app and how to download it and set that up. I'm not sure if the video is there for how to do this for Android. So if you have Android, please reach out to me and I'll send you the details on how to download the store. You can now name your device. So if you've got 5 or 6 minis in the clinic, you can put a name to it, and you can change a lot of the settings. You can change the intensities, but you can also put together any number of timers, and we're still working on a wake-up timer for the device, but that's one of my dreams, is to be able to set it and tell it to wake up at 2 a.m. on a real low level and calm the nervous system back down into its sleep mode. But anyway, right now you can do an awful lot of things with that app. Slowly we're going to add to that. One of the nicest things about it is if we can further refine some of our energies in the mini, we can just send you an update. You can see on that screen on the right, the device is updating. Anytime we make a major change and after testing it thoroughly, make sure that it could help everybody, we can just push out an update that you can now update your device from wherever you are throughout the world, which is helpful if you're in the Netherlands or somewhere in Australia. The next thing I wanted to go over, and we'll watch this video because these are some of the most important things that we've figured out with concussions, both chronic and acute, and that work wonders. There are times when we have to modify things just a little bit, but in somebody who's had a concussion, I will always now start with their feet. You're thinking, you know, all their symptoms are up around their head and neck and face, but the reality is when you took things offline, it affected everything clear down to the toes. So if you will take the time to go through some of those techniques to reconnect the nervous system from the feet up, it helps tremendously. In fact, just that technique alone sometimes takes away a lot of the dizziness and disequilibrium that our patients with a chronic or acute concussion are feeling. So we're going to watch through this one. Pay close attention to this, and we'll make sure you have a link to watch these after.
Let's learn how to manage the symptoms of a concussion with the resonance of the tuner. You can use your Tuner Pro 2 or your Tuner Mini for this recipe. You'll also want your extremity pack or strap. Remember to place your tongue between your teeth and hum gently along with the resonance of the tuner. This helps your vagus nerve to magnify the positive effects. Step 1. Set the tuner to the highest level that still feels comfortable. Let's use a firm amount of pressure as we scrape your feet and legs. Start scraping between your toes, then do your feet. You should be able to complete this step in just a couple of minutes. Now let's give some attention to your calves. When you're done, move up to your thighs. Now switch sides and do your other foot and leg for another 2 minutes. Step 2. Set the tuner to the highest level that still feels comfortable. You might need an assistant to scrape your back. Start at the base of your tailbone and scrape up towards your neck with a firm amount of pressure. Continue scraping your back for 2 minutes. Step 3. Set the tuner to the highest level that still feels comfortable. Using a firm amount of pressure, move up your arm and scrape towards your shoulder. Make sure to pay close attention to any sore or tender areas. You should be able to complete this step in just a couple of minutes. Now let's use the tuner wing to scrape between your fingers and on both sides of your hand. Let's switch it up and give your other arm some attention. Step 4. You can select blue mode or a low level for this step. If you're using the Tuner Pro 2, attach the tongs and place them on the back of your neck. If you have the Tuner Mini, place it in the extremity strap and attach it so that it's lightly pressing against the back of your head. Let's start by turning your head as far to the left side as possible. Orient your eyes to something specific in the corner of your vision. Then move your eyes in an X pattern, followed by a plus pattern. Now turn your head to the right side and repeat. Continue to alternate between sides and patterns for up to 5 minutes. If you're having issues with dizziness, go ahead and look straight forward instead of turning your neck. Step 5. Select green mode on your tuner. On your weaker leg, use the extremity pack with the Mini or the tongs and strap with the Tuner Pro 2 to attach the tuner to your calf with a light amount of pressure. If you're experiencing acute symptoms, walk around for 10 minutes. For chronic symptoms, you'll want to extend the time to 60 minutes. Thank you for joining us today. Let's learn how to...
So one of the cool things that we have figured out in working with people is this little process of reorienting the eyes or orienting the eyes with the movement patterns and that gentle vibration at the same time. If any of you have not tried this, it is absolutely mind-blowing how quickly, going from tips of the toes all the way up and reconnecting the nervous system and then reorienting the eyes, how quickly that will bring somebody out of almost all kinds of conditions. But for our people that have had a brain injury, this is life-changing for them. They start feeling their body and they start coming out of their dizziness very, very quickly. So I'm excited to hear your thoughts on doing some of those techniques. Now on vertigo, it's a lot the same, but again, there's
we'll cover the protocol for addressing vertigo.
There's an advanced recipe for vertigo. We'll make sure that you have the ability to see these. I don't want to cover everything right now because I want to save some time for questions. And the advanced plantar fasciitis, we covered some of that in that first video. So I'm not going to cover that right now. But I want to talk a little bit about another thing that we've found extremely important. Now, there is a problem. I don't have a great resource for getting tons of these, but these little mouthpiece attachments that we've found, we do have them on our website. I think we've got about 60 of them in stock. We're trying to find a way to mass produce those because I really like the effect of sending that resonance through the teeth. You know, we've been doing the inside the mouth techniques for a long time, which helps tremendously for taking the tension out of the jaw, out of the masseters, out of the pterygoids. You know, incredible results with that technique. But I'm rather fascinated with having a person bite down gently, repeatedly for several minutes on one of these little mouthpieces and attaching our resonance through it, as you can see with this young man in the picture. This young man is a pitcher on his college team, and taking that, you know, relaxing that area can make such a difference for the shoulder and everything that that is involved in pitching. When we talk about thyroid, there's a couple of things that I would like to go over.
This recipe is just what you need to de-stress your entire body.
Now, one of the things that's really important about that is you've seen our techniques on calming the body. Did you realize the application for those techniques for things like your thyroid? If you just think of all that's attached to the thyroid and how much is controlled by the vagus nerve in that particular area, and the autoimmune conditions that are oftentimes associated with that, our whole body de-stress is absolutely incredible for thyroid issues. There are times, though, when you need to be able to wake it up if it's sluggish, and times when you need to be able to calm it down when it's hyperactive, right? So here's where the important step in that is what you do with the with either the Tuner Pro 2 or the Mini, and that is how you utilize the colors. So your red color, by the way, all of those videos on our website to go over all of these particular colors and what they do. Typically, if we need to grab the attention of something like the thyroid gland, we're going to put it on red for just even just 20-30 seconds and put it in the vicinity of the thyroid. We'll put it on red. We'll put it on red. Sorry, we have a few of you need to make sure you mute your mics until we have our question and answer session in just a little bit. But if you can put it on the red, any area that is diseased, it helps the brain make a better connection to that area. I know that, and I've seen it over and over and over again. We'll talk about that a little bit more in just a minute. But to wake up something, put it on red, either one of our devices, and put it in the vicinity of that particular organ or part. As soon as you've gone through maybe just a couple minutes like that, or even a minute, stick it on green or blue and put it in the same area. If you'll hum or have your patient hum with that, this process of using the red first, followed by the green or the blue, and putting things back into balance after you've taken them out of balance, is incredible for helping our people with autoimmune conditions. I'll give you one really quick example. We had a a person that bought one that had MS for 20, she's had it for 27 years or so now. And she had been, after she'd been using our tuner for about a year, the tuner broke. So we got a chance to interact with her because it broke and she needed it fixed. But she reached out to us and she said, I've got to tell you something about my particular case. She said, I have been using your device daily for the past year. And a year ago, I got my scans done because I get scans every year with my MS, and it showed that my nerve functioning was continuing to decline. She said, I just repeated my scans a month or so ago, and it is the first time since I've been diagnosed with MS that I show a significant improvement in nerve myelination. And along with that, I have energy. I'm being able to do things. So this whole body de-stressed set of techniques is absolutely incredible for just teaching the body and the nervous system how to, number one, wake up its connections and start to heal them. So neat to see that 28 years into MS, we can finally see some significant
Thanks for calling Floatwell. This is Chris. How can I help you?
daily use of those tools were what helped. She did primarily this whole body de-stress process.
Oh, I'm sorry.
And then I don't know if any of you guys got a chance to watch Dr. Ed Chauvin a few weeks ago, but or whenever we had the last Masters or Masters Circle group get together. But Ed has figured out something that has blown my mind since that conference. And I can't do it justice. I have played with it. I have seen that it's absolutely accurate. And so I'm going to give you just a teeny little synopsis of what it is if you haven't seen it. But Ed has figured out how to use those colors of the Mini or the Tuner Pro and identify organs that are kind of not functioning. And it's fascinating. You can place the device in its, you can place it on the green or the blue, and you can place it in proximity of a set of organs, for example. Let's say you put it over the pancreas, you put it on blue or green, and the individual tests strong. You put it on red, which is what we're seeing as an identifier. You put it on red, and if there is an actual process, an actual problem, they will muscle test weak, and all of a sudden their nervous system kind of caves in on itself. Their feet will go skiwampus. And if you can see that there is a problem there, what Dr. Chauvin has done is go back to the nerve roots that communicate with the brain about that particular area, wake them up, and you'll do that by just turning the device on high, scraping that particular dermatome or myotome area, waking up the spinal cord, sending up those messages to the brain. You then go back to that organ and test it on red again, and you will find that it has gone strong. It has strengthened that particular connection, and it is fascinating. I've now tried it on a whole bunch of people and seen that you can identify which organ or which part of the brain is turned off and flip the switch, get it back functioning, and you can see immediate results by using the combinations of the reds and the greens and understanding anatomically how to reconnect those areas. So I would, I can't do it justice, but I think the next time you get a chance to see Dr. Chauvin, I would recommend you spend a little bit of time watching what he has figured out how to do. It's rather fascinating. Labor and delivery. This is my daughter. We now have our 8th grandchild that came about 2 months ago. So this is a fairly recent picture. My daughter says it was one of the most absolutely delightful things to realize that even through her significant labor pains. They found that you could put a tuner on the feet or behind the neck or behind the back and help her through that. I've now seen that process work on my own grandchildren or my own daughters and daughters-in-laws, but we have nurse midwives. We have OBGYNs and others who have used this with their patients, but it's a wonderful thing to use in labor and delivery. The Rezzimax Resilience Program, this is our program for PTSD. I'm going to tell you just a couple of things, but if you'll go back to those recipes on the website, this is a fascinating way. You can see that she's got a tuner on her lower left leg. She's right-handed. So as you can see, we're using this process and the dominant versus non-dominant pass to rewire the central nervous system for traumatic events and traumatic experiences. And it doesn't need to be that. It could be just allergies, and it could be lots of other things. And I realize that many of you are trained in some great techniques. This is a wonderful way to use the resonance of the tuner to rewrite some of the trauma code in the brain. But take the time to watch the presentation that we did for IAFNR on how to implement this. We've seen incredible use for those who have been through traumatic experiences, even if they don't remember them. Then with our pediatric conditions, if you go back to our website, see if I can find this really quick. If you go back to our website and you go through the Tuner Pro 2 recipes, and this is a fascinating area. I hope that everybody gets a chance to spend some time with this. But if you go to the recipes for primitive reflexes, we've taken the main primitive reflexes that all of you might see in the clinic on a daily basis if you're testing for these. And we've shown you how to utilize the tuner or the mini for either of those, for any of those primitive reflexes. And if you haven't spent some time on that section, I really recommend it. Extremely helpful. I see we do have some things in the chat. I want to make sure. Oh, you're good. Please mute your devices. Thank you, Brian. Where are the advanced recipes under the affiliate login? We don't have those advanced recipes published yet, Mary Grace, but I'm going to give you guys links to all of those, and we're adding to those quite a bit. Francis says polyneuropathy with the Tuner Pro 2 clamps around the calf muscle. Would you advise the red or the green program, and how long? Like I was talking about earlier, using the red for just a short time, followed by the green or blue, is what seems to wake up the brain's connections and put it back into a balanced rhythm. So I would certainly do the scraping first, and then I would follow that with some of the algorithms to wake up those connections. I think that's all of the questions that I see for right now. So let me get out of that. So does that make sense? The primitive reflexes, I'm not going to take the time to go over all of those because I want you to spend the time on our website for very important reasons. We have spent thousands and probably tens of thousands of dollars to create these video resources for you. I need you to spend some time on them because it helps our YouTube views go up. But more than that, we never get enough time to go over every technique that our devices can do for you guys and to help your patients. You've got to spend some time on these resources that we put together. And if you need us to create more resources because you don't see them there, please let us know what you'd like to cover. But just about every condition that you're facing with your clients, we've addressed some kind of technique or set of techniques that are going to affect that particular area. So make sure that you spend some time going through all of these. Now let me get back to making sure I'm on track here. Ultra sensitive nervous systems. This is something we need to take 4 or 5 minutes on. With our POTS, with our CRPS, our mast cell activation, our trigeminal neuralgias, our fibromyalgias, the biggest piece of advice that I can get you is be careful and be slow. You will find that for example, with CRPS, I just don't go anywhere near a super painful area of the body. You can always find safe zones on an individual, and if you can't find a safe zone, start a few feet away from them and work towards coming closer and closer to contact with a safe zone. So if a person has trigeminal neuralgia, I will almost never go to that area that is so fired up. The reason for that, and you guys all know this, it's a brain issue, not a body part issue. It's a central sensitization issue in the brain, and so we're treating the brain, we're not treating the painful area of the body. Not until it calms down enough that it can accept treatment. So I'm going to go to anywhere on the body that's a safe zone and send messages to the brain, scraping by placing the device until the person, and I'll have them hum, I'll have them work through those techniques. Sometimes I'll start the trauma process very early in treatment because I need their nervous system to learn how to calm down. But with all of our ultra sensitive processes or people that have these processes going on, we've just learned the best thing is to stay away from the area. Don't draw attention of the brain to that area. Let's move on something that is not sensitive until the nervous system calms down. And we have seen that work now in hundreds, if not thousands, of individuals with the suicide diagnoses. And that process works almost every time. A little bit more when a Rezzi dies. Let's see, I put a video link in here, or a link in here, so brings back up our website. Here's the important thing for you on our website. If you have a return or repair, click on the very bottom of the website, pull up that form. It talks you how to troubleshoot if you've got some issues with the device, but it also talks you through, you know, what it's going to cost if it's out of warranty, what we're going to do if it's in warranty. Has a little form for you to fill out and submit that to us so that we can start interacting with you to get a broken device back, or to help you understand how to get a device that's working funny back on its feet. This is also a helpful tool for your patients. The reason that we put that all on there is these devices do wear out. I mean, it's a motor, and it's a spinning motor that creates the energy that we have come to love and know as the Rezzimax intensity and settings. Anyway, it does wear out, but the nice thing is we can fix almost anything that goes wrong with these. So make sure that you understand how to be able to find us on the bottom of the website if you have a return or repair, or if you want the form for HSA eligibility. Those are some other resources that are on our website to help you out. A couple of things about monetizing the Rezzi, and then we should have about 5 minutes left to take any additional questions that we might have. Some of the most successful ways that we have seen our practitioners being able to monetize what they're doing. Now, let's just go through those. One of the first ones that's been really helpful is if you have a small supply of these in your office, and you have a rental program where you let the person, the day that they try the device in your office, let them take one home and start using it from that day. That is a tremendous benefit. And here's why. If they have a remarkable result in your office, let's say they were able to feel their migraine headache turn completely off, that person is going to be grasping at anything that can help them find that relief when they're home. So if you can send them home with a tool and say, look, you're going to use it for 2 weeks. At the end of 2 weeks, we're going to take your rental price and apply it to purchasing your own. Many of your clients will take you up on that. And from our doctors that do that, almost every one of them ends up in a purchase. And if it doesn't, it's at least $100 of revenue for them using one for a couple weeks. A second one is purchasing training with their specific condition. I like this one. You know, our training, we have a lot of things on our website, but they really have to know what they want to use it for to be able to find the right kind of video to be able to help them. But you know their condition. And if you'll sell the Tuner Pro 2 kit with a training and say, for the next 8 visits, I'm going to take, 5 minutes and train you on a particular thing that's going to help your nervous system maximize the results with this device. Several of our doctors are doing that and finding extremely good results with that. But you may be an office that doesn't want to carry a supply of tuners there. You don't want to tie up some money in keeping a stockpile. The other thing that works really well, and this is, we've now seen tremendous results since putting together a Rezzimax affiliate program. And if you saw on our website over the far right, that's where you can learn all about the affiliate program. But many of our doctors have earned thousands of dollars by making a recommendation, doing some training. We've got excellent training resources that you can utilize. In fact, some of you have taken us up on being involved in some of our Rezzimax training on site. We've had some of our greatest doctors come from Japan and Australia and different parts of the globe to come and hang out with us. But we've videotaped almost every class that we've done, and we put those resources into our training program so that you can have access to that. But there's a certification process that if you'll go through and make sure that you understand head to toe how to utilize our device, we'll put you up at the highest level, where your client gets $75 off when they use your code. And you get $75 that gets deposited into your PayPal account. So it's like $150 is our marketing program. You share it with your patient. And that has been a tremendous help for us. Almost never when a person has utilized that that affiliate program, meaning they've heard about it from a doctor, hardly ever does one come back to us saying, we don't know how to use this thing. Because they trust our affiliates, they trust our people that understand how to use these tools. So if you'll take some time and get Jeff, if you'll use that. If you'll take some time, maybe I can mute you. If you'll take some time to get to know our processes through that affiliate program, it helps tremendously. I think that's all the big things that I have on this. Again, we'll share all of this with you so that you can take some time and go through questions that you might have. But in the last 5 minutes that we've got, what questions do you guys have? Go ahead and unmute or raise your hand or something, and let's hear what questions you have, or if you want to share a really cool thing that's happened by using some of our techniques. I need to thank the Cloud Chiropractic office. They sent a few of their folks to our last training in Florida. Anyway, any questions that you have now?
Sherrick, I got a question for you with the concussions program that you were talking about. What kind of time frame, like usage, do you typically start with somebody when you're not sure, let's say for that, or even somebody that's too sensitive, if you're not sure how they're going to respond?
Brian, that's a great question. And Here's what our experience has been. If you typically go straight to the head and neck and the areas of their strong symptoms, you'll blow them out typically very quickly. And I have had a number of you try this and give me feedback, and I've tried it as well. If you will follow the recommendations that I made there for starting at the feet and the hands and the spine and waking up those connections, almost never will you see a person get blown out. Meaning their tolerance goes up remarkably. So I had a doctor recently do this, and they had a person that was so sensitive they couldn't tolerate the vibration around the head and face. So they did all of those techniques around the feet and the legs and the arms and the hands and the spine, and sent them home and said, come back in the next, come back in tomorrow. The next day, that person was no longer sensitive with any of those areas. They could go right to some of their fastest treatments, and they were just tolerant of everything. But I believe that that's because that work from the tips of the toes up creates a reboot for the brain. And as soon as it reboots and settles itself, tolerance to activity goes up tremendously. Great question.
That's perfect. Thank you.
Mm-hmm. Other questions that we have? I don't see anything more in the chat. We have 2 minutes if you've got any other questions. Well, let me just tell you that working with the tremendous professionals in the Master's Circle has been really good for me, because you guys have challenged me to try and figure out better and better ways to be able to share this information. As you can see, we have done that. We have risen to the request to provide the information, but you guys need to know where to find it. So on our website, we host links to everything now to make that a lot easier for you. So thank you for your time. Any techniques for aortic aneurysm from Joe DiCarlo? Joe, I don't typically recommend anything to treat specifically that area, but the whole body de-stress, I have seen the whole body de-stress techniques, and the techniques like we just described earlier today. I have seen those drop the blood pressure by 10 to 20 beats in a person that's hypertensive, which is a tremendous help for aortic aneurysm or some of these conditions where a person's about to have a blowout. You've got to calm the system so that there's not so much pressure running through those pipes. So that's my approach to those, even though the first thought would be, what can I put on the chest to calm that person down or to help them? I would actually go to the feet and the hands and the back and other places to get their nervous system to start calming down. That's where you're going to see the best benefit. I think I'm out of time, so I'm going to stop the recording. If anybody wants to stay on for a couple more minutes, or you've got some additional question, I'll be happy to take those after the recording.